Antipsychotics are horrible drugs. Why forced psychiatric treatment should be outlawed. Speech by DFR. He sits in an impressionless room, agitated by a pressurized feeling he lacks the words to describe, faced by demons in white coats who are blind to his suffering. They are men of their time, mired in their culture. It's hard to describe why this occurs, but they are unable to look above their day and age to see things in their proper historical context. Antipsychotics, both a blessing and a curse, should not be forced on anyone due to its barbaric nature and its barbaric treatment. Antipsychotics makes a person feel bad and horrible in most cases, and only in a minority of cases does a person hardly feel okay, and even rarer do they feel good. That's why they shouldn't be forced on anyone, because they not only cause suffering, but in a lot of cases cause extreme suffering, which sometimes is inescapable, and changing antipsychotics doesn't work, or it is out of hand because the person is unable to voice their complaints, either due to side effects, where they are unable to voice their side effects to their doctor and that they are suffering, which can happen to a few, or they can't voice side effects because the doctor will extend their forced psychiatric treatment, or they can't voice their suffering because of any other reasons that may be. This can sometimes lead to suicides. So instead of healing and better mental health, it leads to worse mental health and death. The forced psychiatric treatment does that. Antipsychotics can feel like depression times 100 or 1,000 in severity or suffering. Antipsychotics can cause emotional blunting and anhedonia. This often happens. You can lose complete interest in everything and at the same time feel really bad, called dysphoria. You can feel really bad feelings all the time or at certain times of the day or sometimes. Despite having these side effects, doctors still force them on you if you had a known psychotic episode and they say the benefits outweigh the disadvantages. Rarely can you get away with not taking antipsychotics, even when citing these reasons and appealing to higher authorities. This is insanity and outrageous. No one in these modern times should have to suffer in these awful and extreme ways. These people feel left out, and as outsiders watching the world have normal feelings and enjoying interests and leading normal lives, while forced psychiatry leaves people in a chemical prison where they are left outside. I get that antipsychotic treatment can have its blessings. It can cure psychosis if given as a course of treatment for 9 months to 1 year and give people their mind back, but it should be respected that treatment is very barbaric and this treatment is in its early stages of development. Psychiatry in this regard is in its early stages of development and is akin to the barbarity of early stages of surgery before anesthesia came in the 1800s. This is skirted around verbally by the psychiatric profession and not acknowledged at all, which it should be. Antipsychotics should certainly never be forced long term for more than a year if the patient hasn't become cured, because of the suffering it causes. Because of the barbarity of the treatment, it becomes a sensitive case and should be handled with care. The short-term treatment with antipsychotics should always require the patient's full consent because of the treatment's barbaric nature. But this is not the case today. These people undergoing this treatment should be met with sympathy and you should feel sorry for them. But instead they are met with forced care, if you could even call it care, coldness, cruelty, meanness, and derision, because of the stigma surrounding bad mental health. Also because psychosis is seen as a condition where the person is seen as less than and inferior and crazy, despite a half of the people recovering fully after 9 months to 1 year of treatment. This issue with forced psychiatric treatment is called the last civil rights movement of the century. We are living in historic times and are fighting and leading the way in a historical battle. We are in the right side of history. The moral arc of the universe is long, but it bends towards justice. History will prove us right. Forced psychiatric treatment will be outlawed and will only belong to the history books. It will be written of as a dark chapter in history. Join us in our fight to make forced psychiatric treatment history. Thanks for watching.